I've just lost a tooth. What do I do? Well, the best thing to do is to visit with your dentist and discuss all the options. There's really 3 different ways we can help replace that tooth. The first thing would be a partial denture. It can be a little cumbersome because it comes in and out and it clips onto your existing teeth, and most patients aren't really comfortable with that, but that may be the best option for you. The next would be a bridge, and what a bridge is if you look at a space that needs to be filled in, a tooth on each side of the space can be part of that bridge, and we can hang a new tooth between those 2 crowns that bridge that gap. Hence the term bridge. It bridges the gap. So if you think of a bridge across the river, you got one pillar on one side and a pillar on the other and something hanging in the middle. Well, on a dental bridge, you have a crown on one side, a crown on the other side, and one hanging in the middle. That's a great option. In fact, it was pretty much our only option that we had for many years. But nowadays, we have implants. So implants are a little different than a dental bridge because we're not really interfering with the teeth on each side. We're actually placing an implant down in the space, and after 4 months of recovery after having the implant, and what I mean by recovery is that the bone kind of grows to the implant, we can build a tooth to place on top of that. That's really your 3 options to replacing a tooth when you've lost a tooth. As you've listened to this video, if you have questions or it makes you think of a family member, I ask you first to share the video with your family member, but encourage them if they have questions to go ahead and call our office, let us know who sent them, and we'd be more than happy to visit with them, answer their questions, and even to make an appointment with the doctor in our office. Don't wait until it hurts.